As I sat in my armchair sipping my morning coffee, I couldn't help but think about the vast differences between California and Canada when it came to medically assisted deaths. The numbers were staggering. While California had reported around 800 cases since 2016, Canada had exceeded 44,000. I thought back to my conversation with a friend who had lost his mother to a terminal illness. He had told me about the struggles they faced in finding adequate palliative care and how the option of medically assisted death had been presented to them as a solution. My friend had been torn, wanting to alleviate his mother's suffering, but also feeling uneasy about the idea of ending her life. As I pondered this, I realized that the issue at hand wasn't just about numbers or statistics. It was about the value we place on human life. In Canada, the laws surrounding medically assisted deaths had been expanded to include individuals who were not terminally ill, but rather suffering from chronic conditions or disabilities. While I understood the desire to alleviate suffering, I couldn't shake the feeling that we were slipping down a slippery slope. Were we truly helping people, or were we simply giving up on them? The numbers in Canada seemed to suggest that we were abandoning our most vulnerable citizens, rather than providing them with the support and care they needed. I thought about the countless stories of people who had been misdiagnosed or had recovered from conditions that were deemed terminal. What about the individuals who were pressured into ending their lives, either by family members or healthcare providers? The lack of transparency and accountability in Canada's system was alarming. As I finished my coffee, I couldn't help but wonder what the future held for our society. Would we continue down this path, where human life was seen as disposable? Or would we take a step back, reevaluate our priorities, and find new ways to support those who were suffering? The answer, much like the solution to this complex issue, remained elusive. But one thing was certain: we needed to have a more nuanced conversation about the value of human life and the implications of our actions.